The next category is the stickers. Stickers include vertebrates and invertebrate animals. We'll discuss them in greater detail shortly. There are approximately 1,000 fish species that pose a potential threat of envenomation to humans. The best known culprits are the scorpionfish family. In order of increasing toxicity, they are the torois family or lionfish, which are very popular with marine aquarists, scorpionfish, commonly seen on shallow reefs, and the notorious stonefish, which may even survive out of water for periods of time and is the most venomous fish known to man. Handling these fish underwater is unwise. Scorpionfish have various spines containing a heat labile myotoxin that affects both skeletal and cardiac muscle. Upon injection, there is immediate pain with blanching and cyanosis of the area. J.L.B. Smith, a famous ichtologist who also described the coelacanth, describes his own accidental envenomation by a stonefish in great detail. He describes the pain as being so intense that he recalls little about it, and in fact about the first hour. Various remedies were tried as he was eventually about to lose consciousness. Then his wife, Margaret, dunked his hand in a bucket of warm water with almost instant relief. Nevertheless, he developed extensive blistering and loss of skin and was unable to use his right thumb for the best part of 2 years due to residual stiffness, and had trouble with it for the remainder of his life. For scorpionfish, the treatment includes extracting spines, removing any visible pieces of sheath, and then applying hot water immersion, which is very effective. Local anesthetic injected directly into the wound may also be helpful and has the additional benefit of being absorbed into the lymphatic system and thereby numbing the lymph glands as well. One has to be careful not to numb the hand and subsequently boil it accidentally in water that is too hot. Intermittent exposure to 45 degrees centigrade water, which is then the equivalent of 113 degrees Fahrenheit, is optimal. X-rays are usually required to exclude retained remnants that will perpetuate pain and infection until they are removed. Wounds should be adequately irrigated, debrided, and explored for remnants. Wounds should not be sutured, and prophylactic antibiotics and Tetox should be administered. The most dangerous period following envenomation is the first 4 hours, at which time the victim should be very carefully observed. There is an antivenom available in Australia, and it's quite effective. 1 milliliter of antivenom neutralizes 10 milligrams of venom, which is basically the contents of one spine. Hyoscine and emmetine injected into the wound also appear to be effective, possibly due to their low pH. Stingrays are beautiful and docile creatures. They have 1 to 4 spines on the tail that may be used in self-defense. The spines are covered with a thin skin that is broken when penetrating the victim's skin, allowing the venom to be injected along the grooves in the spine. The spines themselves result in punctures, lacerations, or the combination of these. Deaths have been reported in Australia when large stingrays have punctured the pericardium, pleura, or peritoneum. Steve Irvin has been one of the most recent victims. This illustrates the most common way in which envenomation occurs. This video clip shows it in action. The spasmodic action by the tail could certainly have resulted in a serious envenomation in this case. Here are obvious victims of stingray attacks. The barbs are still in situ. What is important, however, is to always use X-rays or ultrasound to find any retained remnants. These should be removed to resolve the problems with ongoing pain, infection, and delayed wound healing. What is important, however, is to always X-ray these injuries to identify any retained remnants. These should be removed to resolve the problems of ongoing pain, infection, and delayed wound healing. It is sometimes helpful to provide a metal marker to outline the actual puncture site, as some of the barbs may not be readily detectable. Stingray venom is also heat labile and cardiotoxic. The wounds are very painful, lead to hemorrhage and necrosis. Cardiac dysrhythmias are the most serious side effect. Treatment follows the standard guidelines, with heat in the form of hot packs or water being the most effective. Sea snakes. There are some 52 species of sea snakes, all of which are venomous. They're rarely sighted, and yet these are the most abundant reptiles on Earth. They are common in the Pacific and Indian Oceans, but most bites, fortunately, do not result in envenomation. The venom is delivered through 2 to 4 hollow fangs by venom glands. The venom contains 3 neurotoxins and myotoxin. It blocks neuromuscular transmission, and the potency is greater than that of terrestrial snakes. Initially, there is no pain or reaction. Then, neurological symptoms start setting in after about 2 to 3 hours. Slurred speech may be followed by an ascending paralysis, affecting the cranial nerves in reverse order, ending up with respiratory depression and coma. Muscle breakdown and coagulopathy may precipitate renal failure. Supportive care is vital as paralysis sets in, and antivenom, if it is available, is best delivered within 8 hours of the bite, as soon as the earliest symptoms indicate a true envenomation. On the invertebrate side, it's the echinoderms that are the most important to consider. Echinoderms include starfish, sea urchins, and sea cucumbers. The crown-of-thorns starfish is perhaps the most notorious of these. These animals are responsible for the mass destruction of coral in the barrier reef. A recent attempt at eliminating the animals resulted in one of the best published series of envenomations. In the innocent volunteers, it was found that it took 15 to 20 spines to produce serious side effects other than transient pain and bleeding, which was common. Serious envenomations resulted in muscle aches, paralysis, paresthesia, and gastrointestinal symptoms. Delayed foreign body reactions also could occur. Treatment is largely heat, either in the form of hot water or hot packs, local anesthetic, debridement and exploration with X-ray, and antibiotics and tetanus toxoid, when these should be considered. The runner-up as far as toxicity is concerned is the long-spined sea urchin. The hollow spines contain venom glands, and the spines are covered by venomous mucus and thin epidermal layers of skin. Venom is introduced by penetrating the skin of the victim or breaking the spines, releasing its hollow contents. The result is intense pain, swelling, and redness. If joints are penetrated, a serious synovitis or tendon sheath inflammation may result. It's important to recognize that spines may release their surface pigment without the actual spine remaining behind, like a form of tattooing. Treatment is then rather straightforward. Remove all the visible spines, use hot water for pain, X-ray or ultrasound any potential residual spine remnants, and if they're near or in a joint, explore the wound and remove them. Consider the use of antibiotics if there's evidence of infection and if surgery was required. These 2 images show the range of possibilities. On the left is the hand of a child that has been playing in a tidal pool, inadvertently touched a sea urchin, and withdrew the hand, with the marks being due to pigment. There were no actual spines left in tissue. On the right is an adult who developed deep penetration of spines into the metacarpal joint space, necessitating surgical removal. On the low range of risk is the short-spined sea urchin that produces the attractive shells that most people have seen in tidal pools. They populate the intertidal zone in colder waters and are often a hazard to shore entry. They are an indication of healthy coastlines. The spines are not venomous, but they are a foreign body and may cause infection or delayed foreign body reaction. Experience has led us to recommend that if more than 10 spines are embedded, it is wise to remove them to avoid granulomas. Application of vinegar may help dissolve the spines, and steroids may help reducing the inflammation. X-ray and ultrasound are useful to locate spines and to determine whether there's need for removal. Sea cucumbers are a delicacy in some parts of the world. However, some species contain a venom that is introduced by the sea cucumber inverting its intestines upon an unsuspecting victim, usually when stepping on it. Painful erythematous lesions may result, but the greatest danger is if it enters the eye, which can actually lead to corneal blindness. The treatment is similar to other coelenterate envenomations. In the case of ocular envenomation, heat is only of limited value, and cycloplegia and cortisone must be recommended. Sponges have been used for many centuries as bathroom accessories, but only once the resident animal has vacated its skeleton. While it's there, sponges contain foreign material that may be irritating to the skin, such as silica spicules that may cause penetration of the skin with edema and vesicular lesions. Treatment includes removing the spicules with adhesive tape, dissolving them with vinegar, and using antihistamines and cortisone to limit reactions also improves the outcomes. Antibiotics and tetanus toxoid may be indicated. Mollusks may also contribute to some of the sticking invertebrates. Of 45,000 species of mollusks, only the cone shells and octopus present a danger to humans. Cone shells are sought after by shell collectors as they are quite beautiful and valuable. However, the venomous tooth of a cone shell is able to deliver a lethal paralytic muscle relaxant similar to curare. There is nowhere to hold the shell to avoid envenomation. Results of envenomation are relatively predictable, with pain, cardiac and respiratory depression following. Bleeding abnormalities and even death may occur. Treatment includes the conventional ABCs, hot water, observation, supportive therapy, and treatment for coagulopathy. This illustrates the predatory nature of the cone shell. The yellow object is the venomous radula or tooth penetrating the unsuspecting fish. The fish is captured and ingested. The next creature to consider is the beautiful blue-ringed octopus. The salivary glands acquire a venom called maculotoxin that is identical to tetraodotoxin. It blocks sodium channel transport, causing neuromuscular paralysis. The bite is numb initially, and paralysis sets in within about 10 minutes. Cranial nerve palsies and respiratory and cardiac depression develop. Unfortunately, this is one of the few venoms that is heat stable. All that can be offered is supportive therapy, atropine, acetylcholine esterase inhibitors, and life support. Consciousness is preserved. Scrapers. Briefly, scrapers include all marine creatures that have an abrasive surface, allowing colonizing bacteria to enter the skin upon inflicting an injury. Various fish have non-venomous barbs and spines that would also introduce pathogens. The treatment is therefore really at limiting the infection, including cleaning the wound and the use of prophylactic antibiotics and tetanus toxoid. Shockers. Electric rays are slow and ineffective swimmers and are usually submerged in mud or sand in shallow depths where they are found throughout the year. On both sides of the spinal column are two kidney-shaped electric generators that can deliver an electrical discharge between 8 and 220 volts. The current is passed from the electrical negative underside to the positive top side of the fish. The electrical discharge is immediate upon touching the animal, although physical contact is not required to be shocked, and successive shocks can be delivered, although with lessening intensity. Then there follows a latent period in which the fish regains its electrical potential. Shocks are rarely serious, but may lead to unconsciousness and therefore drowning. Bearing in mind the various potential injuries that humans can sustain, what should be on a first aid kit? Well, in order of importance, it should include epinephrine, antihistamines, cortisone, antibiotics, anti-inflammatories, topical cortisone cream, EMLA, and neosporin. Not to forget tetanus toxoid. Other items include copious amounts of vinegar, shaving cream and razors, forceps, adhesive tapes, hot packs, hot water, disposable gloves, steri-strips, dermabond, and a skin staple gun, bearing in mind that there are many wounds that should not be sutured, although injuries to the face are usually okay due to good blood supply. I would also add injectable local anesthetic. Although not available in the United States or South Africa, sea wasp, sea snake, and stonefish antivenom may be available. If you are diving in areas where these creatures may be found, it may be wise to check local stocks if they are available. Finally, we'll be brief in considering the problems related to the ingestion of seafood. There's one human death for every 1 million tons of seafood we eat. The most important causes of mortality are paralytic shellfish poisoning, ciguatera, and tetraodotoxin, together with infections. We will consider the first three. The toxins contained in seafood are acquired in different ways. Most accumulate due to the animal ingesting toxic plankton, which is mostly harmless to the fish, but very harmful to the biped predator. Pufferfish have been thought to be inherently poisonous, although it has now been found that cultured pufferfish are not, which suggests that they also acquire toxicity. Finally, the decomposition of certain fish may produce toxicity. Poisonous plankton is the source of the majority of seafood poisons. Hazardous algae blooms are the result of surface water being displaced by offshore winds, allowing upwelling of deeper, colder water containing plankton spores and oxygen. Upon arrival in the well-illuminated surface zones, there's a plankton bloom. Due to the massive production of biomass under these ideal conditions, oxygen supplies are rapidly exhausted, resulting in death of the organisms and the release of their toxins. These are then filtered through various shellfish, rendering them toxic, and this may continue for as long as 6 months. This map shows the distribution of hazardous algae blooms in the United States, and one can note that the paralytic shellfish poisoning is common in the colder waters of Maine, California, and Alaska, whereas ciguatera poisoning is a tropical disease. Paralytic shellfish poisoning. This is an example of red tide, which leads to paralytic shellfish poisoning. There are various forms of shellfish poisoning, but we'll focus on this one in particular. Hazardous algae blooms with Goinulux catenella produce saxitoxin, which is concentrated in the resident shellfish, and 2 to 3 mussels may contain enough poison to kill an adult. Gary Powers, the U-2 pilot that was downed by the Russians in the 1960s, had with him a suicide vial with saxitoxin. As you might expect, the poison is analogous to tetrodotoxin and inhibits the sodium-potassium pump in nervous tissue. Symptoms may occur within 20 minutes to several hours depending on the combination of food and alcohol. The first evidence is perioral paresthesia with subsequent weakness and paralysis. Treatment is supportive, and note that the fixed dilated pupils may be the result of the poison rather than actual brain death. Ciguatera poisoning. This form of poisoning is also due to ingestion of poisonous plankton, with the interesting phenomena of concentrating up the food chain from herbivorous to carnivorous fish. The name is derived from a poisonous marine snail first encountered by the Spanish settlers in the Caribbean. Plankton ingested with coral eventually becomes stored in large carnivorous fish. There appears to be an association with the destruction of marine life and coral reefs precipitating ciguatera epidemics. The British occupation of Mauritius failed in 1748 due to the destruction of the reefs in preparation for landing. Similar events have occurred in response to natural or unnatural destruction of coral reefs. Ciguatoxin is harmless to fish and concentrates up the food chain, with the viscera being the most poisonous. There are 3 major toxins, including ciguatoxin, mitotoxin, and scaritoxin. Ciguatoxin blocks sodium channels in the open position, resulting in continuous depolarization of the nerve cell. Demyelination of the spinal cord and brain may lead to long-term effects. Cholinergic effects result in bradycardia and hypotension. Symptom onset is typically fast, within 15 minutes to 4 hours, and there are 4 symptom complexes that may occur in different combinations and severities. The gastrointestinal side effects are usually associated with lower levels of poisoning, especially with ingestion of lower concentrations of herbivorous fish. The cardiovascular and neurological symptoms are more common with the ingestion of large carnivorous fish. Respiratory failure may result in death occurs in about 1% of cases. Reversal of the sensation of hot or cold is one of the classic signs of ciguatera poisoning. Mitotoxin causes norepinephrine release, whereas scaritoxin has the additional effect of inducing vertigo. There is unfortunately no reliable way to determine if a fish is toxic or not. Smell, color, and taste are normal. Folklore suggests changes in silver coins or coconut if cooked with a fish, but these have no scientific basis for reliability. Small fish, of course, are safer, and the locals are a valuable resource on the safety of certain species of fish. Japan has produced a monoclonal antibody test, and one that has been released in the US by Oceanet, but the cost is approximately $30 for 5 tests, and it takes about 45 minutes, so it's not really taken off. There's of course the cat or granny test, because kittens are very sensitive to ciguatoxin, and family elders may be a more traditional substitute. Treatment obviously includes ABCs. Stomach emptying is indicated up to 6 hours after ingestion in conscious persons, and intubation with gastric lavage for incapacitated individuals. Activated charcoal may be of value. Atropine may be valuable for the cholinergic side effects, and calcium gluconate for the neuromuscular dysfunction. Mannitol has proven to be one of the best and most effective remedies in acute cases. 250 milliliters of a 20% solution with a maximum of 1 gram per kilogram appears effective. Mannitol serves as a sodium channel antagonist and provides immediate relief of all symptoms. Relapses may occur and must be monitored. The diuretic effect of mannitol may also aggravate hypovolemia, and this should be managed. Symptoms of ciguatera poisoning may persist for years after the major recovery has occurred. Similar fish should be avoided forever. Fish meal fed to farm animals may result in paradoxical sensitivity to poultry and pork. Alcohol, or in fact any nervous system stimulant or depressant, may elicit symptoms. Insomnia and depression may follow poisoning and may need therapy. Pufferfish, or tetraodons, meaning 4 teeth, offer one of the most profound forms of poisoning known to man. Chinese and Egyptians already recognized this form of poisoning, and the Bible advises against ingesting scaleless fish. Wade Davis published an autobiography called The Serpent and the Rainbow, which was eventually captured in a major film and depicted the effects of tetraodotoxin and the origin of zombies in Haiti. Tetraodotoxin is soluble in water, heat-stable, serves as a cholinesterase, and blocks the sodium-potassium pump, depressing neuromuscular function and the sympathetic nervous system. The symptom onset may be within 5 minutes, with numbness, paresthesia of the lips and tongue, gastrointestinal symptoms of nausea, vomiting, diarrhea, and pain, respiratory symptoms of paresthesia, respiratory muscle paralysis, and eventual inhibition of the respiratory center with a mortality of 50%. Collapse of the cardiovascular system may lead to hypertension, whereas the central nervous system may also be affected with twitching, leading to ultimate muscular paralysis, bulbar weakness, and fixed dilated pupils. Therapy is supportive. Anticholinesterase such as neostigmine may be considered, atropine for the bradycardia, and sedation during ventilation, as consciousness is not affected. Scombroid poisoning. Scombroid poisoning involves histidine in tissue, which is converted through degradation by decomposition and bacteria to saurine, which is a histamine-like substance. The fish has a sharp, bitter or peppery taste. The type of fish involved is actually not salmon, and rather includes tuna, mackerel, jack, bonito, albacore, and maybe mai, bluefish, and anchovies. Symptom onset is typically within 10 minutes to an hour, and includes severe headache, arrhythmias, shock with hypotension, a severe rash over the whole body, burning, urticaria, bronchospasm, and possible respiratory distress. Essentially, it's analogous to an allergic reaction, except it would be epidemic in that many people are affected. The whole body wheals are rather characteristic. The symptoms usually, fortunately, only last a few hours, and death is unlikely. The treatment focuses on bronchospasm with beta agonists and steroid inhalers, antihistamine, intravenous cortisone, and supportive therapy. There are several other causes of poisoning. They include clupioid or herring poisoning, which is rapidly fatal and similar to ciguatera poisoning. There's also crustacean, gastropod, gempelid, hallucinatory fish poisoning, ichthyohemolytic, ichthyohepatotoxic, and ichthyototoxic poisoning, mercury poisoning, shark and ray poisoning, and turtle and tortoise poisoning. How to avoid injuries. Most importantly, to avoid hazardous marine life injuries, buoyancy control skills should be practiced. One should be aware of one's surroundings, look up and around when ascending, shuffle feet when entering water, and wear thick-soled boots and fins. One should avoid carrying speared fish and streamline one's body and equipment so as not to irritate one's undersea and streamline one's body and equipment so as to avoid irritating fish and creatures underwater. One should also know what hazardous marine life may inhabit an area, to pack a first aid kit and oxygen unit able to deal with emergencies that may arise, wear appropriate exposure protection, even in warm waters, and be passive when interacting with marine life. One should avoid using the reef to stabilize oneself, avoid picking up shells, avoid eating raw fish. And training may be had in the form of the Divers Alert Network First Aid for Hazardous Marine Life Injuries course. One needs to understand the risks and be wise about one's choices. Similarly, diving itself is a wonderful sport. Only 2% of injuries involve hazardous marine life, and mostly these are relatively trivial. Diving remains one of the most marvelous sports we are able to enjoy.